everyone, welcome back to Powai Physio. This is Dr. Priyanka Mulyantiwar. Today we are going to discuss a very common thing, which is a frozen shoulder, and about the exercises which will help you to come out of its pain and the movement restriction. So basically frozen shoulder mostly appears after the age of 45 or so. It may appear because of previous injuries, it may appear in the diabetic. It is a very common thing in a diabetic people as well, and the symptoms are pain in your shoulder joint. There will be restricted movements in your shoulder. People will find it difficult to take out the t-shirts. There will be difficulty in combing their hair. So today we are going to learn the exercises which will be helpful for reducing the pain and increasing the movement or decreasing the restriction of that movement. So first set of exercise which we are going to do is pendular exercises. So as the name suggests, pendular exercises means you have to just release or relax your shoulder joint and move and make it move like a pendulum. So suppose my left shoulder is a frozen shoulder, it's an affected side. So what you have to do is you have to stand beside the wall, or you can take a support of a chair or a table, and if you are taking a support of chair or table, put your hand here, affected or unaffected hand, or I am taking a support of a wall. You need to bend forward slightly and take your affected arm sideways, and just like a pendulum you have to move that limb. Okay, now the other second exercise for this is just take your arm in front of your body and move it in this way. So first we took it sideways, then in front of your body. Third, just rotate the shoulder, just rotate it. Okay, so these three are the pendular exercises. The next set of exercise is take your arms back, hands on hands, and if this is the affected side, what you have to do is you have to raise your affected sides till your shoulder blades. Now people are having difficulty in taking your arm behind. So in such cases, what you can do is you can take a help of a rod or a towel. So I am taking a help of a rod. So whenever you are taking a help of rod or a towel, what you have to do is your affected arm should be down, behind and down, and the unaffected should be up. So see. So what I am going to do is, because this is affected and this cannot go or this cannot move up on its own, I am holding the stick or a rod with my left hand, and with the right I am taking this hand up. So this is the movement which will help my left hand to move up till the scapula. If you have a lot of restriction in your this movement, initially might be the movement will be less, but when you do this exercises regularly, definitely you will see the improvement in your movements. Now the next and the last two exercises for this are, take the rod like this and raise your arms up. Raise your arms. The second exercise and the last one is just take it like this. Okay, so these are the exercises for the frozen shoulder. If you are doing this on a regular basis, for sure your movements will be increased and your pain will be reduced. There are many exercises which are required in the frozen shoulder. If you want to know more, please stay tuned and keep liking and subscribing our channel. Thank you so much.